guys, it's Khaki. Today I'd like to talk to you about the process of advancing your diet after weight loss surgery. I get so many questions about this. And while all teams, all bariatric programs have different guidelines, most are pretty homogenous and fit in the same general idea. Of course, if you have any specific questions, always reach out to your surgical team, but let's talk about it. I'm going to speak about the guidelines from my program. And like I said, most programs are pretty similar, and some tips on how to advance through them. When I was sent home from the hospital, the night that I had surgery, I was sent home the next day, but starting the night I had surgery, I was on a clear liquid diet. I could have things like popsicles, water, tea, that kind of thing. Not much else. Jello that wasn't red because they don't want to have anything that might look like you're bleeding. I was on that diet until the next day. The next day, I could start advancing to a full liquid diet, which for most programs includes things like protein shakes, jello, uh, sometimes pudding, tea. My program allowed decaf coffee, some don't. The non sugar sweetened juice, kind of like the V8 Splash, as long as it's sugar free, the diet. My program wanted me to stay on that for 2 weeks. And I think that was a good idea. I feel like that really rested my new pouch and allowed things to heal and to get me ready for the next step. The thing that I hear a lot from people is concern right out of the bat about not getting in their protein intake. You're not going to. You're probably not going to get that recommended protein intake for several months, honestly. And that's okay. It takes months for protein deficiencies to have any effect, to really happen. The main thing that you need to focus on in those early days post op is hydration. The number one cause of rehospitalization after bariatric surgery is dehydration. So work on getting those sips in of water, of non sugar sweetened beverages. Just really try to get that in. Hydrate yourself and let your tummy rest. After 2 weeks, most plans will advance you to either a puree or a soft diet. My plan wanted me to do a puree for 2 weeks and then advance to a soft. I'm going to be honest with you. I did not do that. I just could not stomach pureed food. So I did very soft food and chewed. I remember my very first meal when I could eat soft food. I scrambled an egg and I put a little bit of Laughing Cow cheese in it. It made me so nauseous. I ate it slow. I probably ate a fourth of the egg, and it made me nauseous and it scared me. In hindsight, I know from a lot of patients and from my own personal experience that whole eggs, for some reason, are not well tolerated by a lot of people. Egg whites are. So that's a tip. When you first start out, try egg whites first, and then if you tolerate that well for a little while, try a whole egg. It took me about 3 months to be able to tolerate the yellow part of the egg. In this stage, also, most plans are okay with things like pudding, cottage cheese, refried beans. This is where that ricotta bake comes in that most of you have seen recipes for. What I did during this stage, I got little 1/8 of a cup, so well, actually a fourth of a cup, little 2 ounce plastic containers like you get from a restaurant with condiments in it, and I meal prepped with cottage cheese, with the ricotta bake, with refried beans with a little bit of Greek yogurt. Oh, that was another thing I could have at this point, Greek yogurt. And I ate 2 ounces at a time, and that was it. I made sure, even if you think about cottage cheese, the ricotta bake, pudding, refried beans, it's already kind of that pureed consistency. So I ate 2 ounces. That was all that I could eat. And I ate 2 ounces about every 2 to 3 hours. At this point in my journey, I could not tolerate protein shakes at all. So I did really well to get 20, 30 grams of protein in. But in the end, it was fine. So those foods that the reason the diet advances the way that is suggested is healing. You have got fresh sutures, fresh staples. Anything that puts pressure on those staples, anything that might rub and cause irritation during this stage is not good for you. So don't try to speed things up. Follow the guidelines. There will be plenty of time in the rest of your life to eat other things. You've been through so much going through the pre op process, the surgical, and now the post op process. Just do it. Just follow the guidelines. After that, for me, at 1 month, I was able to start adding in soft protein sources, things like tuna fish, maybe some flounder that was crumbled up, dark meat chicken. I was so glad to get some dark meat chicken. It was wonderful. And the reason that dark meat chicken is tolerated better than white meat chicken at this point is the moisture. If you think about dark meat has a little bit more oily, a little bit softer texture. That's what you're aiming for at this point. I also added in things like green beans, um, squash that was very, very well cooked. Those were pretty much the only vegetables I got at this point. So what I would do is I would weigh out about 2 ounces of protein. I rarely could get it all in, and about a quarter cup of whatever vegetable I was eating. My plan did not allow fruit at this point. So I would have one of those vegetables or just the protein. I used little spoons, little forks, little plates. I still use little plates. And I would take a bite, chew slowly, try to wait several seconds between bites, and then take another bite. I would take 2 bites of protein to 1 bite of my vegetable. And most of the time, like I said, I wasn't getting 2 ounces in. That was the maximum that I could get in. Anytime that I ate something, and this is what I advise my patients, anytime that you eat something and it doesn't sit right with you, stop. Don't eat it again for a few weeks. If you eat it again and you have the same reaction right away, sometimes it can lead to a food aversion, which is not good. It may just be that your stomach isn't ready for it. It's not something you can never eat, like me and the eggs. I waited a few months and I can tolerate whole eggs now without any problem. So just don't push yourself. Take your time. Follow the guidelines. My plan did not allow or did not recommend fresh vegetables or fruits for 3 months. So, no salads, no fresh vegetables for 3 months. And I can see why. Those things your body has to work to digest. So, for that 1 month to 3 month, I mostly had soft proteins. I did start going up a little bit in the texture of my proteins. I think you will find you can start adding in things like ground beef, maybe ground turkey, maybe some white meat chicken, maybe salmon that's has a little bit more texture than flounder or cod. Again, don't push it. Just take your time. Take your time. This is a lifelong journey. We're not in a race. So, advance very slowly. If you have any difficulty at all, back off. Even if there were some days that I got up that morning, ate something, just didn't sit right, and I drank a couple of protein shakes the rest of the day. At that time, here's another tip. I started being able to tolerate protein shakes again, but I couldn't tolerate a whole one. I would pour about 4 ounces of a protein shake really cold, drink it. Wait an hour or two, drink 4 more ounces. Wait an hour or two, drink the other part. That way I could start building up on my protein. But I didn't do a whole lot of protein shakes after about 2 or 3 months because the goal for all of us is to get to real food, is to introduce back those whole foods that are not ultra processed. We want to be able to go out to eat in restaurants. We want to be able to eat what our family eats, maybe with some modifications. We don't want to be the person sitting in the corner nibbling on a protein bar for the rest of our lives. So we've got to work through these stages to get to that point. After 3 months, I started eating salads. You will find when you're ready that you can eat a pretty good volume of salad. Think about when you chew salad, it basically liquefies. So you're going to be able to eat more volume. You can eat a big bowl of lettuce based salad most of the time, whereas you can only eat a small amount of protein. So don't let your mind play tricks with you. Don't think, "Oh my gosh, I've done something wrong if I can eat a bowl of salad." That's just the way your body digests and how it breaks down. After 3 months, I was pretty much able to eat anything in small quantities. What I would do after about 3 to 6 months is I would take my plate. I still, to this day, weigh my protein. I would weigh out about 2.5 ounces of protein and a half a cup of non starchy vegetables. That a lot of times I wasn't able to finish. I still did the 2 bites of protein to 1 bite of vegetable. And I would try to eat slowly. That's always been a struggle. But I would listen to my body and try to really pay attention to those fullness cues because it's very easy to go from hungry to miserable when you've had bariatric surgery. You don't want that. And again, sometimes I would eat something just that I had tolerated great and it wouldn't sit well with me. So I would avoid it for a few days. After about 6 months, I bumped it up and now I measure out 3 ounces of protein. And 90% of the time, I can get that 3 ounces in. At the advice of my dietitian, I also started adding in a small amount of carbohydrate, something like sweet potato, like brown rice, just a tiny bit, um, pumpkin, winter squash, a little bit of corn, maybe, those kind of things. She recommended that I do my protein. I do a third to a half a cup of vegetables and just a couple of tablespoons of some kind of starch and finish the rest before I get that starch in. And that has really helped me by following their advice to get to the point where I'm pretty much eating anything. I still don't eat a lot of pasta. I talked about in a previous video on my recent trip that I ate rice and noodles for the first time, white rice and noodles, and that it kind of scared me because it filled me up very quickly, but it did not make me sick. And I don't want to go back to those habits. Noodles and rice are kind of empty foods. There's not a lot of nutrients in it. So focus on those things that give your body nutrition. I read one time, and I always remember this. After bariatric surgery, your stomach is very valuable real estate. It's very, very precious. You can only put so much in it. So make what you put in it work for you. You wouldn't buy a $20 million lot on the beach and put a junky trailer on it. You would really be careful what you did. Do the same for your body. I would love to hear any questions that you've got, how you processed, if you're post op, how you processed through introducing new foods. Anything that you had problems with, I would like to hear. Any challenges that you had. If you're pre op, any questions that you've got, or post op too. I'm not a weight loss surgery expert, but I am a weight loss surgery patient and primary care provider. I would love to also hear any video suggestions that you've got. I hope everybody has a great week, and I will see you next Wednesday. Bye.